to the advocacy training for CHWs. This is really exciting. This is a refresher course, and it's really grounded in the fact that community health workers have a story to tell, and we need to advocate by telling our story. And so this is an opportunity for us to take some training on advocacy and learn what we're going to do for Advocacy Day. It's really a refresher for those who were part of the annual meeting, which was annual meeting last year in October. So you'll see some of the content that may be familiar to you from there, but we also have we've got some additional content too. So we're just happy to have you on the call this morning. We've got great co-presenters, and I'm going to let them introduce themselves. But we'll start with our next slide, which is just giving an overview of our training objectives for today. So next slide, please. Great. So our training objectives for today is really advocacy overview, again, telling our story, looking at how to engage legislators and stakeholders, and then talking about the next steps for our Advocacy Day. As we go through the presentation, if you have any questions, we're asking you to please use the chat function, which is it's the icon, looks like a message bubble. You can put your questions in that chat feature, and then we'll answer those at the end. Next slide. Great. So introductions, who's on the call? So we're going to go around. We'll start with the presenters, and then we'll open it up for everyone that's on the call to introduce yourselves. Let us know what your name is, what organization you're representing. Are you currently a community health worker, or have you ever been a community health worker? And have you participated in an Advocacy Day before? So we kind of would like to know your experience if you have. So again, my name is Tressa Crosby. I'm with Mercy Health. The Health Project is the department that we're with. I am currently a community health worker. I've been doing community health work. This is my second round of doing it, so I've been with Mercy Health for 8 years, but I started before that with Mercy Health again. So I have close to about 15 years worth of work in community health work. And then have I participated in an Advocacy Day before? No. So I'm very excited to participate in the one that's coming up to tell our story. And I'm going to task it over to Deidre.
Good morning, and thank you again for joining today. I'm Deidre Hurst. I am the Interim Executive Director for Michigan Community Health Work Alliance. And I did serve as a community health worker early on in my career, but I'm not currently a CHW. And I have participated in Advocacy Day before. And I will pass it on to Kelly Cawthorn.
Hi, I'm Carrie Linderoth. I am a lobbyist and healthcare attorney with Kelly Cawthorn. I am not a community health worker, but I have had the fortune of being able to participate in quite a few different clients' advocacy days, and I'm very excited to work with everybody on this team.
And hi, I'm Melissa McKinley. I work with Carrie at Kelly Cawthorn, and am not a community health worker either, but again, like Carrie had said, we have hosted many, many lobby days, and we're very excited about the opportunity to help with this one and bringing you all to Lansing.
Hi, everyone. My name is Hallie Reneker. I am hosting the WebEx here at MPHI, and we are assisting with Mishwa and Mercy in planning this Advocacy Day. And MPHI is also part of the EAPC group. And I just want to note for those of you who are going to start introducing yourselves, I've tried to go in and mute you as you come in just to eliminate background noise. And so you might have to unmute yourself in the WebEx application itself. There's just a little microphone icon that you can click on your screen to unmute yourself.
Good morning. My name is Clarence Burnett. I'm on the line with Brenda Smith. We're community health workers here at Henry Ford Health System, and we both have been community health workers. I've been about over a year, and she's been for quite a few years. And I believe she have participated in Advocacy Day before. This will be my first time.
Great,
you guys
welcome.
Hear me? Thank you.
Someone else on the call?
Yeah, can you hear me?
There we go. We hear you now.
Oh, okay. Thank you. My name is Linda Reyes, and I'm also with Henry Ford Health Systems. I've been to Lansing for advocacy before on other matters, so this will be my first time with Henry Ford, I guess.
Great. Welcome, Linda.
Can you hear me?
Uh-huh.
My name is Jennifer Green. I work at Unified HIV Health and Beyond at the Ypsilanti office. I'm a case manager, which is the same thing as a community health worker, but I got trained in community health worker earlier this year, and I've never participated in Advocacy Day before.
All right. Welcome, Jennifer.
Thank you.
Good morning. My name is Lisa Isom. I am from Great Lakes Bay Health Centers. I have been a community health worker for about 2 years now, and I have never participated in Advocacy Day before.
All right. Welcome, Lisa. Good. A lot of first-timers.
Thank you.
Hi, this is Craig Lamb. I'm with Great Lakes Bay Health Centers as well. I'm not a community health worker, and this is my first time in Advocacy Day.
Welcome, Craig.
Good morning. This is Andrea Mosley Cotton. I also work for Great Lakes Bay Health Center. I'm currently a community health worker, and I have never participated in Advocacy Day myself.
All right, Andrea, we got you. Thanks.
Good morning. My name is Maricela Martinez. I am from Great Lakes Bay Health Centers. I did my training and I am certified for a CHW. I've never participated in the Advocacy Day either.
Welcome, Marisa. Anyone else that we're missing?
Hey, Tressa, Shannon Lieski. This is Shannon Lieski joining as well. How are you?
Good morning, Shannon.
Hi, can you hear me?
Uh-huh, got you.
Okay, my name is Cheryl Buck. I am with the Michigan Association of Health Plans. I'm a consultant for the Michigan Association of Health Plans. That association represents the Medicaid health plans and that contract with community health workers, and I am an observer and have attended Advocacy Day before, but I'm interested in this training. Thank you.
Thank you, Cheryl, for joining us on the call this morning. All right, have we gotten everyone?
This is Courtney Latimer from Henry Ford Health System. I currently supervise the Community Health Worker Hub at the system, and we deploy community health workers through different departments within the hospital and health system, and I have never participated in Advocacy Day before, so I'm very excited to do so.
Thank you. Welcome, Courtney.
Good morning. This is Omar Jones. I'm a community health worker with Great Lakes Bay Health Centers. Currently a community health worker, and I have participated in a few of the training sessions before.
Okay. Well, welcome, Omar. You'll get a good refresher today. Anyone else we've missed?
My name is Andrea Crosser-Burton, and I am representing Everyday Life and the Rural Community Health Worker Network here in the Great Lakes Bay region. I am not a community health worker at this moment. I have been in the past, but currently I am one of the CHW MSHWA trainers, and I have never participated in an advocacy day before.
Welcome, Andrea.
Thank you.
Okay, we want to make sure we give everyone a chance to introduce themselves. So, okay. Well, if you didn't have a chance to introduce yourself, please use the chat function, and we just want to make sure that we record the folks who are here and have an opportunity to get to know you and kind of get to know your experience with advocacy in the past. So that was our goal, and some of you guys have had experience. Wow. A lot of us have not. This will be a first time for us, and so we're super excited that we get the chance to do this together. It feels good to be able to do it as a group. So we'll move on in our presentation, and we'll ask Hallie to move us to the next slide. Okay, great. Deidre.
Good morning again. Next slide, please. So why be an advocate for CHWs? Community health workers in Michigan care for many of our most vulnerable populations. They make a huge impact on the lives of their clients. However, CHW programs across our state struggle with sustainability. So advocates can have an impact on policy and help create pathways to sustainable funding for community health workers. Next slide, please.
So the purpose of CHW, oh, go ahead. Did I hear you, Deidre?
Oh, go ahead.
All right, so the purpose of CHW Advocacy Day, when we're heading down to Lansing, you know, we have to be looking at why are we going? And so our purpose is to educate and increase legislator awareness of the profession of community health workers, again, the critical health and social service benefits that this profession provides, and the challenges that CHWs face. Many of the legislators, much like the clients we serve, they are not familiar with the term of community health worker or peer navigator or the different terms that we fall under. So part of our role is to educate individuals to our profession, the work that we do, and why it's so important. Next slide.
And today, MPCA wasn't able to join us on the call, and so I'm going to cover their slides, but we do want to recognize that they had valuable input into this presentation here today. But advocacy. In its most basic understanding, advocacy is supporting a cause. It can happen in organized days like our CHW Advocacy Day. It can happen in conversations with influencers that are in person or over the phone or letters or even on social media. Advocacy is acting in solidarity with a group who shares your perspective on an issue. And good advocacy spreads awareness about the cause and results in change in policy. It doesn't always have to involve lobbying. Advocacy is simply giving a voice to the cause that you believe in. Next slide, please. So there are common forms of advocacy. And first, I just want to say, don't be afraid of the term advocacy. I'm sure that many of you already have skills. So I'm going to share two quick examples of how CHWs may already be advocates. So example one, Joe, a CHW, learns from several of his clients that they don't fill out their intake documents fully in the lobby because they can't understand the document and would be better served if they had someone read it with them in private. He brings this issue to the attention of the office manager and works with others in his office to come up with a solution. Together, a few CHWs, the office manager, and a nurse present the issue and a proposed plan to administration. Because of their advocacy, now the front desk gives each client the option of completing their intake paperwork while they wait, or completing it with a CHW who can answer questions that may come up. This is an example of informal advocacy that many of you probably already do. And example 2 is more on formal advocacy. And formal advocacy involves a more collective and organized approach. So, for example, after changes to a bus line in her city, Kelly, a CHW, observed that it was difficult for some of her clients to keep their appointments. The bus line no longer had a stop at a large low-income apartment complex. She found that this problem not only impacted her clients in a negative way, but it also had a negative impact on many of the people living in this community. They were unable to get groceries and keep appointments to their doctors or their dentists. So Kelly, along with her coworkers, people living in the complex, and other concerned citizens, organized. They wrote letters to the owners of the bus line, to the mayor, and to members of city council. They came up with a common hashtag that they shared on social media pages, and they attended city council meetings to voice their concerns. Eventually, the bus line was influenced to change. The route was reinstated, and additional stops was added to the back of the complex to increase access. So I hope that these two examples help to articulate the ways that CHWs already formally and informally are advocates. Next slide, please. On Advocacy Day, CHWs will have an opportunity to meet with policymakers in Lansing. Sometimes these types of meetings can be intimidating. So remember that legislators are just people who work on behalf of your communities. Give them a clear picture of who CHWs are. Share your story as a CHW. Talk about the importance of having a shared life experience and understanding of the communities that you serve. And discuss how CHWs build trust and explain the way that CHWs use that trust and understanding of their community to remove barriers to staying engaged with a medical provider. Next slide, please. Now, Tressa, I'll pass it to you to discuss elevator speech.
Okay, so when we're talking about elevator speech, or you may be more familiar with the term an elevator pitch, it's a persuasive speech or a persuasive talk that you give to spark someone's interest. It should only take you about as long as it takes to ride an elevator. So it's a relatively short amount of time. It's meant to be brief. It's meant to be direct and to the point. And on an elevator, you can't tell it all, but you can kind of hone into one or two things that you want to share with an individual that could cause them to want to follow up. And so that's what we want to do. As we go in to speak with legislators, we will probably have a short amount of time. And so we want to start with just practicing and preparing ahead of time an elevator pitch. And so we are going to go into kind of the 4 components of an elevator pitch or elevator speech. Next slide, please. So when we talk about the components of an elevator speech, specifically for CHWs, we want it to contain these 4 components, which are a statement about who CHWs are. As we mentioned before, a lot of folks are still unfamiliar with the term. They won't know the acronym CHW, so we have to use community health workers, pronounce it out. And then also, if you move into using the acronym CHW, make sure that we explain it. So a statement about who community health workers are, a statement explaining what programs we offer, what we do, a statement that talks about the benefits of utilizing a community health worker, and a call for action. So in your quick 20 to 30 second elevator pitch, we're going to try to get those 4 things in. Next slide. So we're going to break down each one of the elements and just try to stimulate some ideas for you as you prepare to meet with legislators. First of all, you know, going in, since many of us are very new, we can be super nervous, but we have to remember that legislators are just people like you and me, no different than the patients that we serve, no different than anyone else in our community, although they hold a lot of clout and have influence. But you being that wonderful, persuasive CHW that you are, you're going to walk in there and smile and just share your passion about what you do. So we ask you to start with why as the hook. Why do you do this work? Why do you get up every day and go to work? And it's not because of the paperwork we have to do that motivates us to get there. And community health workers, we appreciate our paychecks, but I don't think our paychecks line up with the passion that we have, right? So there's an internal motivation that gets us up and gets us moving to do this type of work. And that's what you want to shine through when you're speaking with legislators, so that they know that, you know, it can come out as a statement like, you know, I believe that people deserve health care, or I believe people would eat healthier if they had some assistance in knowing how to eat culturally foods that align with their culture, but also can improve their health care. And I'm a community health worker, and that's what I do. I help people to control their diabetes using foods within their own culture. So just an idea of starting with why you're passionate about what you do. And many of us come from different areas across the state. We work in different programs, and our programs have different focuses, which is the beauty of the diversity of what we do as community health workers. So start with what you do and why you're passionate about what you do. And it may be different than what the person in the room next to you does. That's okay. But just start with your individual, your personal why. Next slide. So what do community health workers offer? Tell what CHW contributions have offered at your organization. So again, you can talk about your program, how long your program's been in the community. Are you community-based? Are you based in the hospital? Are you based in an FQHC? What services do you provide? Do you do outreach? Do you help folks enroll in Medicaid, Medicare? Do you provide Medicare counseling? Do you provide education services? Do you work in an office? Do you work out in the community? Those are details that you can share with your legislator about how you do your work and the work that you offer to the community. And then offer vivid examples. That's more of sharing your story, and we'll get into that a little deeper in some slides following. Next slide. What are the benefits? And so this is a place where we really want to make some impact. Tell the advantages of utilizing a CHW program. What makes our services unique? You know, as we are working to distinguish our profession and helping our legislators know the difference between this is nursing, this is a DHHS caseworker, this is a social worker, but I'm a community health worker. And this is what I bring to the table that's different than what all of these other disciplines bring. What makes us a vital piece of the health profession? And so here we can capitalize on the idea that, you know, many of us have walked in the shoes that our clients and patients have walked in. We serve as an intermediary between the community and the health system. We are trusted members of the community, and information they might be afraid to tell their doctor, you know what, they'll open up to us, and then we're able to bring that information back to the provider and then help them to find health solutions. That could be one of the benefits that we share, or it could be, you know, how you helped a patient who came in to get signed up for food stamps, and you also found out that you had a program that offered free eye exams, and they were able to take advantage of that program. You could also talk about an individual who you went to a home visit and found out that their lights were disconnected, and you were able to connect them to a resource to help get their utilities turned back on. You guys have got great examples of work that you do that's critical to the health of your patient, improving their health, which becomes a benefit to the health system, and it becomes a benefit to those who pay for health services, such as Medicaid, Medicare, and those insurance companies. So think about the benefits that you provide. Next slide. Last is your call to action. What do you want this legislator to do once you shared your story? And so we will be provided with packets of information to leave with the legislators, and I'm sure that Kelly Cawthorn or Deidre will go into more detail about that. But it's inviting them to go to a website to learn more about your organization. Read the materials that we have provided so that they can learn more about community health workers. The whole purpose behind this is that we know that community health workers are grant funded, and we're not sustainably funded. Grants come and they go, so jobs begin and jobs end. We are working towards we need sustainable funding, and so within one of the sheets that we have is a policy brief that gives 3 of the objectives that we would like legislators to consider, and the specific wording will be laid out in those objectives. Unfortunately, I don't have that in front of me right now, but we'll be able to share it and to speak directly to it. But again, part of our day, and I think our main focus of our day, is to really share our story and educate legislators of who we are and what we do. Next slide. Over to Deidre.
So what does your story do? I cannot stress enough that your voice matters. Your experiences and perspectives matters. You don't have to let all the decisions about CHW and the workforce of CHW be made by others. You can be active in creating sustainability for CHWs in Michigan by finding your voice and sharing your story. Next slide, please. So effective storytelling. I believe that a good story aimed at making change has to speak to people's brains, their hearts, and their guts. When you have an opportunity to tell a story, use logic to explain the problem. Speak to people's brains. If a patient with a chronic condition doesn't stay connected to their primary care provider, they may frequently end up in the emergency room, driving up the cost of medical care. CHWs help keep people engaged with their primary care provider. Speak to their hearts. As a CHW, you have seen how social determinants like homelessness take priority over keeping a medical visit. You have seen the look in a mother's eyes when she shares that she feeds her kids and often goes without eating herself. So tell those stories. Speak to their hearts. Have you ever just felt that something was the right thing deep down in your gut? You can remind the influencer that you are in front of that the work of CHWs just makes good sense. As a CHW, share how you are a bridge connecting patients and to their provider, how you help to make the communities that you are from healthier. Leave them with a gut feeling that supporting CHWs is just the right thing to do. Next slide, please. This slide gives some examples of ways to tell your story effectively. I think that it's important to practice. You can use these headings to develop responses to the questions that are real and relevant to you. And, if you remember from 4th grade, a story has 5 basic but important elements. There's characters, there's a setting, there's a plot, and there's a conflict and a resolution. So you and your clients are the characters of your story. The plots are the things that happen with you and your clients. And the conflict is the lack of funding to make sure that vulnerable programs like yours don't go away. The resolution and most important part of telling your story is the ask. You are sharing your story because you want the support of the influencer in front of you to do something. So ask. Ask for their support for CHWs. Ask that they come to your office and visit and see for themselves the work that you do. Next slide, please. So now we're going to talk about meeting with policymakers. So just as a reminder, don't be intimidated. Don't forget to make your ask. Speak up and don't confuse being quiet for being polite. If you don't know the answer to a question that's presented to you, it's okay. Don't offer an answer that you don't have. Don't assume that the person in front of you knows about community health workers. And don't forget your responsibility. You can't assume someone else is taking care of advocacy. You have to advocate for your profession yourself. Don't burn bridges. Be true to who you are, but respectful of others who may have different perspectives. And don't forget to express partnership. We are all in this together to serve the greater good. Next slide, please. This slide has some keys to successful advocacy, and it's just important that we recognize that there aren't winners and losers. We are all in this together, and we all have a common message when we come together with the legislators that are in front of us that focuses on CHW sustainability. Next slide, please. Remember, you don't have to lobby to be an advocate. On CHW Advocacy Day, you're not asking for a support of a specific bill or a specific legislation. You are sharing why CHWs are important to our healthcare system, and you're asking for their support. Next slide, please. So this slide has two links in it. So take some time to learn about who your legislators are. The links in this slide direct you to websites where you can see who represents your communities in the House of Representatives and in the Senate. And this is an important step to practice before Legislative Day or when we go for Advocacy Day in Lansing. You want to be familiar with who your representatives are. Next slide, please.
This is Carrie. So basically what we put together is kind of just some common sense stuff about who you're going to be talking to. And I think this came up in one of the earlier slides. And so it's important not to be intimidated by a legislator when you walk in to see them. They're just a normal person, and the conversations will actually kind of develop really quickly as you just introduce yourself and kind of talk about some shared experiences. And it's important to remember, too, that you're a constituent. So what we did is match up folks based on their address of their home address and their work address. So every legislator that you'll be meeting with is somebody that's also a member of your community. So it'll be easy to just kind of transition into that. So introduce yourself, tell them where you're from, and you guys will probably know a few people in common. Next slide. So it's also really important to be prepared. As was mentioned earlier, the elevator speech is really helpful because it'll also make you comfortable. Once you start going through this and you've had a couple of meetings, you'll kind of go on autopilot and have all of your information there. And if you keep your issues to a minimum, I think it also just makes everybody more comfortable because it's kind of like you're dealing with a fifth grader. They don't have a particularly long attention span and they don't have a lot of time for the meetings because they'll be back to back all day long. So if you just keep it concise and to the issues that you want to talk about, it should go pretty smoothly. Next slide. I think this is probably the most important of everything. You don't have to have an answer for everything, but you do have to be able to transition into, let me get that information for you. Another nice part about that is it facilitates an ongoing conversation. So if they have a question that you can't answer, just tell them that you'll get back to them, and then you can respond with an email or a phone call. And I think it will, again, make it much more personal. Next slide. I think this one is also back to the fifth grade part. Just be careful when you're talking to be mindful of your surroundings, because it seems like whether you're in the Capitol, you're in a restaurant across the street, you're in the House office building, there's always people walking around, and you certainly don't want anyone to overhear anything that you might say and get the wrong impression. And then as far as follow-up goes, I think that, because legislators are meeting with a lot of people every day, they're not going to remember every detail of every conversation. So that's why we prepare all of the information to leave with them. And also following up with a thank you note really gives a personal touch to the meeting in general. I think that's everything that we had.
Well, and I will just add, if you don't mind, that just to reiterate, you are the most important person that day. These legislators are faced with hundreds and hundreds of issues throughout their session and throughout their days even, and so you're the expert on the issue of CHWs. You know far more than they do, and they want to hear from you. You are the way they learn about many of the issues that they're facing, and particularly as a constituent. Be flexible throughout the day because legislators' schedules do change, and even though you may have a meeting scheduled with a legislator, you may end up meeting with their staff member. And just remember, those staffers are just as important as the legislator. They actually tend to be more important because their lifespan with term limits is longer in some cases than the legislators even. And so building a strong relationship with them is also very important. But also remember to have fun because it's a great day at the Capitol. You'll get to see a lot. You'll get to do a lot. And we try and make it a very exciting day for you.
Thank you, Carrie. So this slide is just some basic information. So CHW Advocacy Day is April 10th. We start the day off at 8:30, so it'll be a pretty long day for those that have to travel. We've got to hit the road pretty early to get there at 8:30 in the morning. And we'll be meeting at Kelly Cawthorn, which is the lobbying firm that Carrie is at, that has helped us to organize the day, and that's the address in Lansing. So we're pretty excited about seeing you all there. Next slide. I think, again, it's just capitalizing on what we've been talking about all this session long is really why are we there, making sure that we're keyed in and focused on that why. And like Carrie said, we are the experts in our areas. We can share what we do because we do this every day, and we're in the trenches every day, and we're helping people every day. And so we're there to bring the voice of the community and bring the voice, your voice as a community health worker, to the legislators. One of the things we also wanted to mention, I think somebody's got there we go, muted back. But if you're attending, you can also earn a CEU for those who are MSHWA certified CHW. So that's a great opportunity too for you, or another reason to attend. Next slide. All right, over to Carrie to just kind of walk us through the schedule of events. Still there, Carrie?
I'm sorry. I was talking and my phone was on mute. So at 8, we have registration. From 8:30 to 9, we have Melissa giving a legislative update along with a light breakfast. And we go into our legislator meetings from there. And we'll have a breakdown for everybody to see where everybody's going to go. And we have maps and we have all of that arranged for you already. And during that time frame, when we have groups over at the Capitol, we can arrange for them to be recognized on either the House or Senate floor, so your legislators will be able to see you while they're in session. And after that, we'll have a wrap-up once all of the meetings have been completed. In addition to that, we have arranged, this isn't on the schedule, but it's something that we will be adding. We have a formal tour of the Capitol that the facilities folks at the Capitol will be providing, and that'll be at 3 p.m.
Great, very exciting day. So it sounds like it's going to be busy and that it will be organized so that we're able to visit the legislators from our area. Next slide. Okay. Deidre, you want to take this one? Still there, Deidre?
Hello?
There we
Hello?
go.
Oh, okay, I'm sorry. I was talking. I thought I was unmuted. But on this slide, there is the link for registration. You are able to register online for Advocacy Day. Please do it as soon as possible because we do want to make sure that you're matched up with the legislators from your community, and that takes a little time. If you do have questions or concerns about, what to expect, or maybe as a CHW, you need some support with talking to your employer, feel free to reach out to me. My email address is on this slide and also my phone number. Now we wanted to just open up the floor for questions. If we could maybe first review any of the questions that are in the chat box, we can then go on to questions live.
This is Hallie, and I can read the questions. Cheryl just posted a question in the chat box. Have meetings been scheduled with legislators already?
Yes, a majority of the meetings have already been scheduled. I think there's been some folks that have just registered, so we'll be working on getting those coordinated, but we'll have everything together and ready for you when you get here on the 10th.
If there are no other questions in the chat box, feel free to unmute yourself and pose any questions that you have about Advocacy Day, what to expect, or just about advocacy in general. Please feel free to ask questions.
I think I'd like to add one more thing, and that is just to again reiterate, there's nothing to be concerned about from the standpoint of being intimidated or just approaching everybody. Somebody from Kelly Cawthorn will be available to help you navigate through all of this, and we'll be over at the Capitol with you as well. So if things come up through the course of the day, please feel free to reach out, or if you have questions after this, I think our contact information is on there, and we're happy to field any questions you have.
And this is Tresson. I'd just like to encourage those that if you're working in an organization, sometimes some of our larger organizations have directors of lobbying or directors of advocacy, or they contract with lobbying firms. Make sure that your leadership is aware that you're participating in Advocacy Day. And maybe there's a connection if you've got someone, your organization has someone that's already working in Lansing, you could partner up so that you guys are seeing the same legislators and that they can come in to support you. That's one of the things that we've been able to take advantage of for Mercy Health. And I just wanted you guys to be aware of that if you're working with a larger organization that has that resource available, make sure that you take advantage, and that will just make your message even stronger.
Hello, this is Jennifer Green. And my question is, we have a Detroit office and an Ypsilanti office, and I would like to speak to legislators from both areas. Will the registration allow me to put that information there?
Yes, there is information for your home location and your work location. So if you could put both of those cities in, put one city in the home location and then one city in the work location, that way we can provide that information with Kelly Cawthorn, and they can arrange meetings with legislators in both of those areas.
Okay, thank you.
And this is Hallie from MPHI. I just wanted to point out, too, that we are ordering T-shirts for people who are attending Advocacy Day. And we worked with Felicia Lane in the Detroit area, and she found a local T-shirt company. And the owner of that T-shirt company actually used to be a CHW. So this was a really great fit, and she designed some really awesome T-shirts that say community health workers are the heartbeat of Michigan. So they're very nice. And so MPHI will be bringing those for the day of. And so that is another gift that we are providing. And we want to make sure everyone kind of has a similar T-shirt to be wearing, and especially if we're going to have some recognition from the House or Senate floor, it'd be great. So everyone is in the same T-shirt, and everyone is seeing them walk around the Capitol, too.
That's great. Thank you, Hallie. And Hallie, can you share with us, I don't know if we mentioned it at the beginning, but about how many folks do we have registered now?
We have, I've actually had a couple more roll in this morning since we've been on the line, Tressa, and I have 38 people registered so far.
That's pretty cool. So in terms of late registrations, we were asking for folks to register by the 20th if possible. We were doing our call for today. If you know of any colleagues out there in your area that would be interested but maybe haven't gotten the information yet, there's still time to register. We'd just like you to do it as soon as you can. And we really want to hit that 50. 50 is our goal. So just encourage everyone that you know that's a CHW that could potentially make it to come out. Any other questions? All right, well, it seems like we've got everything covered. I don't think there's any additional slides. Deidre, any closing thoughts or remarks?
I just wanted to make sure that everyone feels comfortable with advocacy, and even if you have questions that come up offline about the role of advocacy or what you can do to support if you're not able to attend Advocacy Day, please feel free to reach out to me. I'm definitely a resource for you. And thank you again for participating today.
Great. So it seems like we're going to end this call a little bit early. Once again, we want to say thank you to those who helped make today's advocacy training possible, which includes NPCA, NPHI, Kelly Cawthorn, Mishwa, and Mercy. We really appreciate the support from those organizations for CHWs. And so with that, looks like we've got 8 minutes to give back to you. and we hope you have a great day.